Bad breath on Ozempic, Semaglutide, or Mounjaro, Tirzepatide, is usually not one mystery. It often comes from three tracks: ketones, reflux, or dry mouth. The smell gives clues, but the timing gives better clues. A fruity, sour, or sticky mouth pattern points in different directions. Do not ignore it, and do not treat every smell as the same problem. Many people blame the injection itself. That is usually too simple. These drugs can reduce appetite, change meal size, slow how fast your stomach empties, and make fluids harder to maintain. Any one of those changes can show up in your breath before it feels like a medical problem. The first useful question is not which brand caused this, it is what changed around the same time. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Start with ketones because they sound scary but are not always dangerous. Ketones are fuel chemicals your body makes when it burns more fat. That can happen with fasting, very low carbohydrate intake, vomiting, or eating far less than usual. Weight loss can make ketones appear without an emergency. The clue is a sweet, fruity, nail polish type smell. It may appear after skipped meals, strict low-carb dieting, or several days of poor intake. You may still feel well. If you drink normally and blood sugar is reasonable, the problem may be too little food or fluid. But ketones change meaning in diabetes. Diabetic ketoacidosis is a dangerous acid buildup, usually with high blood sugar and illness symptoms. Fruity breath is not just a cosmetic issue then. Watch for vomiting, belly pain, confusion, deep breathing, severe thirst, or high ketones. Outside that emergency pattern, bad breath may signal that the dose is cutting food and fluid more than your body can handle. The medicine did not create a new disease in your mouth. It may have changed your eating, drinking, and stomach rhythm enough to affect your breath. Reflux is different. Reflux means stomach acid or stomach contents move back toward the throat. Ozempic and Mounjaro can slow how fast your stomach empties. A slower stomach can create burping, fullness, nausea, and a sour taste, especially after large or fatty meals. Reflux breath is usually sour, bitter, or acidic. It may be worse during lying down, bending forward, late eating, or tight clothing after meals. Some people notice more burping than heartburn. That matters because reflux can smell bad even without classic chest burning. Dose timing can make the reflux pattern clearer. Fullness, nausea, constipation, burping, and sour breath may rise together after an increase. Constipation can also increase bloating. More pressure below can worsen reflux above, so the breath problem may start in the gut. Brushing harder will not fix reflux breath. The smell is not mainly sitting on your teeth. It is coming from repeated upward movement of stomach contents. Mouthwash can hide it briefly, but the smell returns if reflux keeps happening. This is where meal pattern matters more than willpower. Smaller meals, slower eating, less late-night food, and avoiding heavy fried meals can reduce pressure behind reflux. Reflux does not mean the drug must always stop. It means you need to identify the meal, timing, constipation, or dose change behind it. If the smell is not sour, look next at saliva. Dry mouth is the quiet third track. Saliva washes away bacteria and food particles all day. If saliva drops, bacteria produce more odor. Causes include dehydration, mouth breathing, sleep apnea, meaning breathing pauses during sleep, nausea, vomiting, diarrhea, caffeine, alcohol, or dry mouth medicines. Dry mouth breath feels sticky more than sour. The tongue may look coated. The mouth may feel tacky, especially in the morning. People often chew mints all day, but sugar can feed bacteria. Sugar-free gum can help saliva move, but it does not replace fluids. Some clues are mixed, so do not force the answer too early. Nausea can reduce meals, low intake can raise ketones, and low fluid intake can dry the mouth. Constipation can worsen reflux at the same time. One odor can have more than one cause. Dental causes still need to be checked. Plaque, gum disease, cavities, tongue coating, dentures, and tonsil stones can cause halitosis, the medical term for bad breath. A medication can expose the problem by drying the mouth, but it may not be the only cause. A timing check can prevent the wrong fix. Morning-only odor points more toward dry mouth, mouth breathing, or dental issues. Odor after meals points more toward reflux. Odor during fasting or low-carb dieting points more toward ketones. Persistent all-day odor deserves a dental exam. The useful move is to stop treating breath as one problem. Ask what changed before the smell started. A dose increase, smaller dinners, low-carb dieting, less water, nausea, constipation, or bedtime snacking can identify the track faster than breath spray. A short log makes the pattern visible. Write down the smell type, time of day, last meal, fluids, constipation pattern, and injection day. Add blood sugar or ketone readings if you use them. The log helps separate ketone-related breath, reflux, dry mouth, and dental causes. Do not solve all tracks with the same trick. Extra fasting can improve reflux for one person and worsen ketone breath for another. More coffee may reduce appetite, but it can dry the mouth. The right fix depends on the pattern. The wrong fix matters because vomiting, diarrhea, or poor intake can become dehydration. Dehydration means the body has too little fluid to function normally. These drugs can make it easier to eat less, so fluid loss can be easy to miss. Action decisions should be based on risk, not embarrassment. Call your doctor promptly with persistent vomiting or inability to keep fluids down. Get urgent help for severe belly pain, fever, confusion, shortness of breath, moderate or high ketones, or very high blood sugar. If the problem started after a dose increase, tell your doctor the timing. Do not simply push through every symptom. A slower dose increase or dose review may be safer. A hydration, constipation, or reflux plan may also help. If there are no danger signs, daily prevention should stay boring. Drink fluids across the day, avoid very large late meals, and clean your teeth and tongue. Clean retainers or dentures daily. Schedule dental care if odor persists. If ketone breath appears during aggressive dieting, loosen the diet before blaming the drug. Add balanced meals that you can tolerate. Include protein, fluids, and some carbohydrate if your doctor allows it. Weight loss should not require dehydration, starvation, or fear of eating. If reflux breath keeps happening, give your stomach more time before bed. Stay upright after meals, especially dinner. If nighttime symptoms continue, ask your doctor whether reflux medicine or dose timing needs review. If dry mouth is the pattern, look beyond water alone. Check mouth breathing, nasal congestion, sleep quality, caffeine, alcohol, and other dry mouth medications. Saliva is not just comfort. It helps protect the mouth from odor, cavities, and gum irritation. So the decision is not whether this is embarrassing, it is what pattern explains it. The useful answer comes from smell, timing, symptoms, and risk signs together. Persistent odor still needs dental review. Bad breath is a clue, not a character flaw. Track the smell, timing, and danger signs so you can fix the cause, not hide the odor. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.